Okay, everyone, I think we will get started. Good afternoon, and thank you for attending this month's Teach Educational Round. Here with us, we have Amanda Gauthier from Algoma Public Health, who will be presenting on Going Underground with Smoking Cessation Network. But before I hand it off to our presenter, I'm just going to go over a few housekeeping slides as per usual. If you're interested in obtaining a letter of completion for this month's Teach Educational Rounds, please make sure that you have registered for the webinar and completed the pre-learning assessment. You have signed in to view this webinar using your first and last name so we can track your participation. And finally, you complete the evaluation and post-learning assessment, which will be emailed to you this afternoon, and you will have 1 week to complete that. These webinars are being live tweeted on Twitter, and you can follow us at PS Quit Smoking or use the hashtag TeachWebinar to post or read questions. As well, just a friendly reminder, today is Bell Let's Talk Day, so make sure you throw in that hashtag as well. Here's a biography of our faculty presenter, Amanda. Amanda has worked at Algoma Public Health since 2011. She grew up in Wawa, Ontario, and has a passion for advocating for health and wellness needs in the North. Amanda worked at Lady Dunn Health Centre, where she experienced caring for patients with COPD and lung cancer related to smoking. Amanda currently works at Healthy Growth and Development Program at Algoma Public Health. She continues to be collaborative with the community partners on the goal of reducing smoking rates by 5% in 5 years. Welcome, Amanda. Here are a list of her disclosures as well as our disclosures. And this is a friendly reminder that the content of the Teach Educational Rounds is primarily based on the evidence-based guidelines from the following sources. These materials, as well as the verbal presentation and any discussions, set out only general principles, and they do not replace the need for individualized treatment plans by healthcare providers. And before I hand it off to our presenter, I just want to familiarize everyone with the new platform that we are using. Please bear with us today as this is our first official webinar using the platform, just in case we experience any technical challenges. If you could please post your questions using the chat feature, and this icon is found at the bottom of the presentation slides. You can just click on that. And when posting your questions, please make sure that you select all participants so it goes to everyone who is attending this webinar. We will not be actively monitoring the Q&A. So without further ado, I will leave it to Amanda to take it away. Thank you and enjoy.
Thanks, Stephanie. So just my own disclosures, I'll just go through that. So we did have some research assistance from the STOP program, as well the Ontario Tobacco Research Unit, known as OTRU, and the STOP program did provide the funding for the nicotine products for this project. And the TEACH curriculum development, so these are based on evidence-based guidelines, including the CanAdapt guidelines, U.S. guidelines for treating tobacco use and independence, the clinical practice guidelines, and rethinking stop smoking medications. Program, the STOP program, was adapted to meet the needs of employees at a rural Northern Ontario worksite, and we had a mining worksite, and to identify some of the challenges and opportunities that were associated with this project. So what sparked the need for this project was the upcoming legislation of cannabis becoming legalized. So that was really concerning to Alamos Gold Mine. They had a strict no smoking cigarette policy, but they were concerned that cannabis use was going to be something that they would see on their work site as well, because although they had this strict no smoking policy, it wasn't easy to enforce. So Alamos management had approached their occupational health nurse, and they wanted more of a plan to have tobacco cessation services right there at the work site, available for their employees. So then in turn, that health nurse, she reached out to us at Algoma Public Health, and we were able to work collaboratively with her to come up with this project. So we knew in Algoma that we had high smoking rates. According to the 2015 Canadian Community Health Survey, rates in Algoma for smoking were 32.6% versus Ontario, which was 18.1%. So we knew that this was important to us to work on reducing smoking rates. So Algoma Public Health collaborated with other community partners, and we had this coalition to reduce smoking rates by 5% in 5 years. So that started in 2015, and it was ongoing until 2020, and is still an ongoing project. So Alamos Gold was definitely very keen at being a partner in this, and their health nurse had actually estimated the rates of smoking to be at approximately 38%. So it was quite high. And there was that concern that smoking was taking place in other areas other than the designated smoking areas. So for safety and to be able to enforce the no smoking policy, they really wanted to get on top of this. So our smoking cessation services at the Wawa Algoma Public Health office, so it was myself and my coworker Emma Blanchett. So she is a psychiatric case manager, and she works in community mental health services. So we are the two smoking cessation workers here, and our role was to fill the gap in needs for smoking cessation in our community. We do have the Wawa Family Health Team, which does offer the STOP program as well. So many of the clients in Wawa are referred to that. However, anybody that's from outlying communities, such as White River and Duberville that are near us, they were able to access us for the program, and then we were able to go and we would work with them in those communities to see them. So really we were trying to fill the gap, not duplicate services. And at that moment when Alamos had approached us, we actually had very few clients, so we were able to accommodate this project. So Alamos was a key partner for sure, the occupational health nurse and the management and the employees. We worked closely with the STOP program and the STOP coordinator. And Ontario Tobacco Research Unit, OTRU, they were able to help us with conducting some interviews and developing a summary report for us. Our own staff here at Algoma Public Health, so myself and Emma, as well as management, were key partners in making this project something that was feasible. So it was key to get input on what the needs were before we started doing this project. So back in May 2017, we actually went out to Alamos and we did a site visit to see what the needs were. So we did a presentation just basically on smoking cessation and what programs were out there, and just kind of trying to feel the waters to see what the needs were. We did bring our carbon monoxide monitor with us, and we were able to have that as a really good tool to show some of the smokers tested it out with us, and they were able to see some numbers on it that were a little on the high side. So they really liked that that was something concrete, that they could see that smoking was affecting that. We were able to have just a conversation with employees about what they wanted, which is really great to hear. And our OC health nurse was key to coordinating all of this and getting everyone together and scheduling all the meetings and everything that we did. So one of the challenges that we faced was just the location. So if you can see from the map on the left, this is Lake Superior here, and Wawa is kind of on the corner of Lake Superior. And then Alamos Mine is located in Duberville, which is about 75 kilometers northeast of there. And part of the road is on a dirt road, so it's quite far away to go to. Takes a bit of time to get to, for sure. So some of the employees that work at Alamos, they actually live out there during their work runs as well. So that's one of the issues too. So access to nicotine products was, the drug coverage that they had was limited, and they needed a prescription to get that access. So getting people to go to their healthcare provider and then collect receipts and submit that, and then have it just at a limited amount was kind of a barrier for a lot of people to access smoking cessation. As well, the location again was out in Duberville, so there is no pharmacy anywhere near there. The closest pharmacy is in Wawa, so that really limited people for purchasing nicotine products on their own. And the employees really gave us that feedback that what they really wanted was to have convenience of having a tobacco cessation program at work that was scheduled during their time that they were going to be at work, so they could meet with the occupational health nurse, and that way they wouldn't be going to outside appointments with healthcare providers and keeping track of all that, but they knew what their work schedule was going to be and that they could just see the health nurse while they were going to be at work. So the schedule was a bit of a challenge. Most employees worked some kind of shift work. Usually it was doing 7 days in and 7 days out at a time, day shift and night shift, and there were other shifts as well. And then employees were from all over the area. So it wasn't just from Duberville, Wawa, White River, but we saw people from Blind River, Sault Ste. Marie, anywhere around the area. Another challenge that was unexpected at the time was that the mine actually changed ownership during the project. Didn't have a big impact on us. We kept on going with the project. As well, the occupational health nurse, she was really kind of winding down, and she was planning to retire, and new occupational health nurses were just stepping into that role. So who were we helping? So the majority of the people we saw were men aged 20 to 50 years old. Many of them had high school and college education. They were earning a good income. They were very hardworking. Some of them reported that they had very minimal involvement with their healthcare providers, that they hadn't seen their healthcare provider in quite some time when we registered them for the program. Some people reported that for some they were triggered to smoke more at work, while for some they smoked more at home. So it was really a mix of where people smoked more. So what could we offer? So when we brainstormed what we could offer, what we really thought we could do at the time was we were going to do the Stop on the Road and offer that. However, at that time, the funding became not available. So then we started to look outside the box and kind of think like, well, it would be a shame to not offer anything. Is there any way we can possibly connect with them and work and offer something? So then we started thinking more about how we could modify the Stop with Addictions program and offer the whole program to them. So just to give you a little bit of background, so Algoma Public Health, we're a unique health unit because we have a community alcohol and drug assessment program. So that's how we're able to have the Stop with Addictions program at our health unit. So we're very fortunate to have that program. And then the Stop with Addictions program, as you may know, it has the 26 weeks of the nicotine patches plus the short-acting products. And then just, again, tweaking the program to work to fit with their schedule. Many of them were shift work, 7 days in, 7 days out, plus other schedules such as 10 days in, day shift, night shift, lots of different schedules. So we pitched a business case back to Alamos we wanted to determine how many employees would use a smoking cessation program, what the cost of a program would be. We showed them that doing the program would help them to enforce their no smoking policy a little bit better. And of course, it was healthy for your employees not to be smoking, more productivity, less absenteeism, that type of thing. And then our overall goal was to help Alamos develop their own smoking cessation program. So we wanted them to build capacity to have their own program. So what that looks like going forward might be working with them to get their occupational health nurse, maybe get them to have teach training, to have more support that way, to have a medical directive to be able to provide nicotine products right then, and maybe to have Alamos actually provide more funding to the program themselves. So to make it work, we were able to go back another 2 times in September of 2017. So we did a very brief presentation, and then we registered people into the STOP program. So the times of the presentations were at 3 p.m. and then at 6 p.m. So we were able to catch the day shift as they were ending their shift, and then the night shift coming in, we were able to catch them. So we registered them for the program, and we dispensed 4 weeks of patches to them initially. And then we had planned to schedule a follow-up phone call with them 2 weeks after the registration. And we did this for each shift. And I'm going to show you an example of the schedule on the next slide. And our occupational health nurse, she always worked consistently on Wednesdays, and that was to be able to accommodate seeing all of the different shifts as they were coming and going into work, so that she would be able to catch both people. So here's what our schedule looked like. So we went there September 6th, and then on the 13th, did the presentation and then enrolled them. And then 2 weeks later, we were able to do a follow-up phone call with the first crew that we had seen. And then another week later, we did a follow-up phone call with the second 2 crews that we saw. So we were able to do phone calls and then have employees meet with the occupational health nurse in her office and complete a visit form from the STOP program on the phone. And from there, we were able to package up nicotine products and have someone from Alamos pick up those products from our office and then bring them out to the occ health nurse, and then she was able to give the products out to the employees on their next shift. So we really had to be like modifying and adapting the program to suit this project. So we were really flexible with our staff schedule. So we have the ability to have flex time at our work. So that was good. We were able to do that. I was able to have the support of my coworker, Emma, so she came with me. So she doesn't typically do that type of work in the community, but because we really wanted to get some smoking cessation projects under our belt and get things out there, we were able to have her help. We were really creative with the timing of the program and the follow-up phone calls. So it meant some evening calls as well. So we would come in at 6:30 and do a phone call with the occ health nurse to make sure that people were able to follow up with us and to get the nicotine products as part of the program. And so it was definitely something new, connecting with the workplace. And there was a lot of collaboration that happened with partners, and the occ health nurse we worked with was really key in making sure that this was something that was able to work well. And she was able to track down people during their shift and leave notes for them, reminding them to do the phone calls, follow up with them, see where they were at, if they were still interested in the program. So she was really, really key at that. So some of our short-term goals of the project were to assist current smokers with a quit attempt. So we wanted to have 8 people per site visit, so 16 people registering, and we wanted to see if we could have 50% ongoing participation rate throughout the project. We also wanted to implement this project and then determine the cost effectiveness, how effective it would be, and to see what a snapshot of the behavior patterns of those employees with smoking was. And then to develop a summary report and provide that back to Alamos. So we actually ended up getting 21 people to participate. We had 10 people participate in the first phone call that we did, and then phone calls declined after that one. So we had the second round of phone calls that we did, we just had 4 people complete. However, at the end of the project, we were able to have 5 people report that they quit smoking. So we were actually really pleased to have those 5 people say that they quit. OTRU, so the Ontario Tobacco Research Unit, they were able to help us by conducting interviews. So they interviewed myself and Emma, so at Algoma Public Health, and then they also interviewed the OC Health nurse, and just to kind of put the project all together and provide a key write-up about what the project was, how it was going. So they did 2 rounds of interviews at 2 to 3 months into the project, and then to wrap things up at 6 months when the project was ending. So from there, we were able to develop our report, share it back with Alamos, and with Algoma Public Health as well. So showing how the project worked, how much nicotine was required, and some of the considerations for moving forward. So then some of the long-term goals, again, like I said, were our overall goal was to help Alamos to develop their own smoking cessation project. So we wanted them to have that ability to offer that ongoing to their employees, to have a nicotine products available, working with OC Health nurse. And how that would work, she would likely would need to have a medical directive and to have some more support with training for smoking cessation, as well as the employer would need to have some support with funding the cost of nicotine products. So how did we do with our long-term goals? So Alamos continues to be an active partner with our 5% and 5-year project. So we are still available to help as needed for ongoing support. And we have had some referrals come through. So we're able to connect people with programs in their area. So, for example, I've had the OC Health nurses at Alamos have asked me about someone who lived in Sudbury. They were able to, we were then able to find out what programs were available and connect them with programs in their community so that they were able to access some smoking cessation programs. Then we kind of had a little bit of a ripple effect happen. So during the project, the OC Health nurse said that there was a little bit of a culture change that happened. So people were talking more about smoking cessation, and they were approaching her more about smoking cessation. So although the project was kind of winding down, a few people here and there were still approaching her and asking her for support, and just a little bit of a culture shift. So the feedback we had from employees, they were really pleased with that we were able to come out there and support them. It was nice that we were able to go on site for sure. Well, many of them were unaware of how to properly use nicotine products and the importance of titration. So not quite matching the amount of the amount of nicotine in the cigarettes they were smoking with the amount of patches or short-acting products they were using. So really, that was really good to get that messaging out there to them that they could use more than what they thought, and they were pleased with that, because in previous attempts they might not have used enough nicotine, so they were a bit frustrated with that. We were able to troubleshoot patch adherence. So mining is a very dirty, sweaty type of job, lots of dirt there. So just troubleshooting how to get the patches to stick when they're sweating, and using areas of the body they wouldn't normally have thought of for patch use, such as like on the foot or lower body. Many of them weren't aware about the short-acting products and to use them with cravings at the same time as the patch. And then just bringing that awareness to them about nicotine toxicity. So if smoking happened to happen, or if they were using short-acting products at the same time as the patch, just some of the effects that could happen. Many of them were quite surprised that they could actually still do that. Having a cigarette while using the patch wasn't the end of the world, but just to be aware of those toxicity symptoms for sure. And then they didn't feel pressured to quit. So we really went in there saying, like, you're in charge. You're the expert on your smoking. You let us know what we can do for you, and we'll be here to support you. And we kind of just let them be in the driver's seat and take charge that way. They really liked having the CO monitor to help measure the effects of smoking. So they liked seeing that number, having a concrete something that they could see was really great. When we did the presentation, we had a young man who smoked quite heavily, and he actually had quite a high number. So it was really eye-opening to see, because he didn't really have any other health problems yet. So it was really eye-opening for the group to see that, yeah, you're doing something underlying to your body that you just can't see yet, and that health effects will definitely sneak up on you with smoking use continuing. So they really did appreciate the program. So some of the lessons learned on our end was that having workplace buy-in and partnership was key at the beginning. So we really wanted to make sure that this project worked. So just having the employees have a little bit of time to be able to participate in the program was really key. Time is money when you're at a mining work site, so we were brief with our presentations. Our OC health nurse was key in making everything happen for sure. And one message that we kind of learned at the beginning when the first site visit happened was that talking about smoking cessation doesn't really do anything unless you're prepared to help. So it was all well and good that we were there telling people they should quit, well, not telling, but we were suggesting they quit smoking and telling them where the programs were, but what they really wanted was that help right there on site, and they wanted it to be more convenient for them. So interventions are more successful in workplaces where people were ready to quit, and we actually had quite a few people that were at that point in their lives. They had smoked for many years, or they were quite young and they were wanted to get on top of this right away. So they were actually really willing to quit. Brief is best, and again, that health equity piece of meeting people more than halfway to make things equitable is okay. So meant a little bit of stretching and flexing and modifying the way that we normally work with our programs, but to be able to offer a program to them was amazing. So again, we learned not to expect 100% success rate. Having the convenience of the program right there on site was really appealing. Our long-term goals are still a work in progress. And it really was quite a humbling experience. So the mining industry in our community is quite essential to the overall economics of our community. We have quite a lot of service providers in our community, but the main industry is mining. So if we're able to get on the ground and help these families out, that was really the core of what some of the work at Public Health is. So it was really great to be able to have this experience. And that's it. So now I'll take any questions you might have.
Thank you so much, Amanda. You might be able to see some questions in the chat box if you can just navigate to that.
Oh, just a question. So the carbon monoxide tester, sorry, yeah, I did realize that in the slides I put carbon dioxide, but it's carbon monoxide levels that we were measuring for sure. And the dates, it was a project that happened in 2017. Yeah. So was the person picking up the nicotine products an employee or someone from a registered healthcare profession? So they were called the runner. So they were like a delivery kind of person that would run into town from the mine every day to pick up any packages and that, and she would pick up the products and then bring that package out to the Aux Health nurse. One long-term, so just this question, is one long-term outcome hoped to be fewer sick days, and how has that changed? I can't really speak to that. Yeah, less employee absenteeism is definitely something that overall would be something that I think quitting smoking would benefit, but I can't really speak to what that actually looks like. But perhaps with working with our Aux Health nurse, like they're able to kind of keep a better tab on sick days for sure. So that's something we can definitely look at for sure. What type of carbon monoxide tester? I would have to find that out for you, and maybe I can email Stephanie and she can let you know. And what does the carbon monoxide tester do? So it basically tells you what the normal range of what a person's range would be if they were not a smoker. So and what the levels would be if you were a smoker. So it gives you numbers on the levels of carbon monoxide. So you breathe into this machine and it registers the number, and it is really kind of a cool little gadget that we had. Yeah. And then the question, did the mental health worker have referrals as a result of the STOP program? So we do get quite a lot of referrals from the mine already. I think I can't really say how many referrals they got because of the program, but they definitely were quite in touch with the Aux Health nurse, and she regularly refers people to the program. We know that smoking can be used as a coping mechanism for people that need some support and might have some mental health needs for sure. So definitely that goes hand in hand with it. Are the employees smoking cigarettes? Are many vaping? So at the time, vaping was still quite new. So we didn't have a lot of people reporting that they were vaping. And actually people were kind of even worried about using the inhalers, if they were able to use that on site but we assured them that that was safe, but like they weren't really allowed to be smoking. It would be really interesting to see actually how many people were vaping, if there's vaping going on at that work site now. is it a tobacco vape-free site? So it's not, so they have a no smoking policy, but there are designated areas that they can smoke. So one of the areas, like, they weren't allowed to be smoking underground. That was definitely something that was not a smoking area for sure, for many, many reasons. There was a designated smoking area outside. So they could kind of only get to that area where they were able to smoke when they were up from underground and when they were having a break, like a meal break. So that was kind of one of the things too, that smoking might be used as a way to get outside, to have a break. So kind of working with Alamos again to kind of make overall health needs, look at overall health needs, such as having healthy breaks, having like meal times and proper, just having a chance to get a break outside. They do have breaks for meals and everything, but just that chance to get outside for sure. So how sustainable was the effort to change the culture around smoking? So we're still working with this mine. From what we've heard from the Aux Health nurses that came into the position, they really haven't seen the smoking cessation as, it hasn't been a priority for them. They haven't seen a high number like the previous Aux Health nurse did. It would be interesting to see, to keep in touch and to see what's going on with that mine for sure. Then how did it work with your medical directive to give NRT to a runner or delivery person? So I think that as far as I'm understanding, I don't think it was a requirement for us to be able, like anybody could pick up the NRT products. I sort of, I guess working as a nurse, we kind of compared it to like picking up like a birth control prescription. So we would often have other people picking up a prescription for like a friend or a family member. So you're definitely able to do that. So that's where we felt comfortable packaging it up. It was all securely packaged. Yeah, and it arrived at the Aux Health nurse intact, and she was able to give out those products, and we would just put the person's initials and their birth date, and we would package it all up securely for them. Is there a higher background level of carbon monoxide at the mine with all the machines? Did non-smokers just higher as well? That's a really good question, actually. We didn't have a lot of data to go with for non-smokers. I think with actually, I can't really speak to that. So that's a really good question. So we'd have to actually do some more experimenting around that. And then, okay, so were any pamphlets or written materials provided to support the employees with smoking cessation? So we mostly stuck with doing a slide presentation, so having a brief presentation. We didn't give out a lot of handouts, but something that we could definitely look into. Our Algoma Public Health actually developed a really brief handout on all the nicotine products that are used as part of the STOP program, and some of the side effects and instructions on how to use those products. So that's something that is something that we've developed since this project. And then the next question about the follow-up schedule to check in on the employee's progress. So just to kind of go through the schedule again, that's probably the most complicated part of this project just because of the nature of their schedules. So we had we had seen like the day shift and the night shift on the first site visit, and then gave them 4 weeks of nicotine products, and then planned a phone call with those people, so the day shift and the night shift. So if you had like shift A and B, so shift A and B would then have their first follow-up phone call would actually be 3 weeks later, 2 weeks later to have their visit with us, and then from there we would send them their nicotine and package it to the OC health nurse. So it was kind of every 2 weeks we scheduled the phone calls with each shift. So we kind of had to work with our OC health nurse to kind of see what shift was scheduled to work, and then when to schedule these follow-up calls. So it was a little bit tricky for us. And then how did the occupational health nurse support those who wanted to quit once the project was done? So we actually got quite a number of referrals back to Algoma Public Health or to the WA Family Health team. People that lived in town were able to access those programs, people that lived in Wawa. We do go out to White River and Duberville as well. And then for people that worked outside of this area, so outside of where I would be able to reach, we would actually try to connect them with their smoking cessation programs in their area. So for example, like somebody that lived in Sudbury that came to the mine to work, he was able to access some smoking cessation programs in Sudbury. So that was really good to make that connection. The underground miners are smoking all the time while they're working. Oh, yeah, so it's hard to say when people are smoking. We did hear them kind of anecdotally tell us when they would smoke, and it was really, a lot of it was just their routines of when they'd come to work, they'd have a smoke, and they would start their shift and they would have a smoke, and just the different times of their shift that they were in a regular habit of smoking. So just trying to kind of break that cycle and to be able to give them that support with the nicotine products. Can I comment on the risk factors that were most important in providing care to this at-risk population? So some of the risk factors I think that we noticed was that people really had identified that they didn't often see their healthcare provider. So I think it was really important that we were able to connect with them, and as a nurse and mental health worker, we were able to just kind of make that connection and let them know that these health effects can really sneak up on them if they continue their smoking use, and that's something that we really urge people to kind of really take notice of themselves, and that they're important for sure, and that to reach out for supports. And again, definitely we had that support with mental health as well, was something that we encouraged as part of the project too. These are some really great questions from everyone.
We still have a few more minutes, so if there are any other questions, please feel free to post them in the chat box. There we go.
So for this project, did we require a special agreement with CAMH for this initiative? So we did pitch it to the STOP program as well. We worked closely with the STOP coordinator to describe the project and what we were doing. So it was definitely approved to go ahead with this project.
Okay, so it looks like that might, oh, sorry, just one other question.
Once mental health was offered, is this something that was pursued by many patients? I can't really say how many people took advantage of that, but it was definitely something that was offered in conjunction with the program for sure.
Okay, thank you so much, Amanda, for showcasing your team's accomplishments with your smoking cessation program. That was a very informative webinar, and thank you to everyone who attended. The chat was very engaging, so that was great. This webinar has been recorded, and I will be distributing the slides and a link to the recording, so you can share it with your colleagues if interested. And you will have 1 week to complete the post-learning assessment if you are interested in receiving a letter of completion. If you participated as a group, please make sure to email teach@kmh.ca with a complete list of participants by 2 p.m. Our next Teach Educational Rounds webinar is the North York Family Health Team Smoking Cessation Program, and that will be taking place on February 26th from 12 to 1. A link to the registration form will be emailed this afternoon. We also need your input. Please complete a short needs assessment survey to help us inform future programming. You have a chance to win a free book. And again, this link will be emailed to you this afternoon as well. And again, if you have missed the beginning of today's presentation, you would like to view it again, or you're interested in seeing previous Teach webinars, a link to our archived webinars is on our site. Thank you so much, everyone, and have a great rest of the week.